Bonsoir. Bonsoir, good evening. We had this afternoon this video conference with the 27 member states, also with Christine Lagarde and Josep Borrell, Mario Centeno, and of course the Commission, Ursula. Member states expressed sympathy with Italy and other member states that are severely hit. We need to work together and to do everything necessary and to act swiftly. It's a strong message shared by the member states. We stressed the need for a joint European approach and a close coordination with the European Commission. Health ministers and interior ministers should consult daily to ensure proper coordination and aim for common European guidance. During the meeting, information and practices were exchanged and 4 priorities identified. First, limiting the spread of the virus. Member states agreed that our citizens' health is the first priority and that measures should be based on science and medical advice. Measures need to be proportional so that don't have excessive consequences for our societies as a whole. The leaders further agreed that on this point they will share all relevant information through existing coordination mechanisms. Second priority, provision of medical equipment. There is an agreement to task the Commission with analysing the needs and to come up with initiatives to prevent shortages. The Commission informed that it will continue its engagement with the industry and pursue joint public procurements. Moreover, the Commission intends to purchase personal protective equipment through the Civil Protection Framework with EU. It must be ensured that the internal market functions properly and any unjustified obstacles are avoided. Particular attention must be given to masks and respirators. Third priority, promotion research, including for a vaccine. The Member States stressed the importance of reinforcing efforts on research, and the Commission has already mobilised 140 million of funds and selected 17 projects to do this. And fourth, tackling socio-economic consequences. The Union and our member states, the European institutions together with the member states, we stand ready to make use of all instruments that are necessary. In particular, we will address any impact on liquidity, on support for SMEs and specific affected sectors and their employees, flexible application of EU rules, in particular as regards state aid and stability and growth pact will be needed, and it will be, of course, the responsibility of the Commission to take decisions with this regard. The Commission will also closely monitor economic developments in the Union and take all necessary initiatives. Member States and institutions will follow up closely and immediately. And, of course, we will have the occasion during the next European Summit, the 26th and 27th of March, to take other decisions in case of necessity. Thank you.
Thank you very much, Charles. The crisis we face because of coronavirus has both a very significant human dimension and a potentially major economic impact. And it is therefore essential that we act very decisively and collectively, first of all, to contain the spread of the virus and help patients, and to counter the economic fallout. And to let me be very clear, the Commission is working flat out on both fronts. The Commission has been entrusted to, first of all, coordinate the necessary measures in a daily phone conference with the health ministers and/or the ministers of internal affairs. Secondly, the Commission will assemble a team of epidemiologists and virologists from different member states to give us guidelines on the European level on a regular basis. Third point, the Commission is now taking stock of all the available protective equipment and the respiratory devices, as well as their production and their distribution capacity, so that we have a European overview about that. These are crucial for the entire health sector in Europe. On research and development, it has already been said that we will reinforce the European initiative to fund targeted research on corona. We have mobilized 140 million euros of public and private funding for promising research on vaccines, on treatment, and on diagnosis. And last sector, on the economic front. First and foremost, we must act at the macroeconomic level. And to be very clear from my part too, we will use all the tools at our disposal to make sure that the European economy weathers this storm. And because it's so important for this message, in Germany too, wir werden alle uns zur Verfügung stehenden Mittel nutzen, damit die europäische Wirtschaft diesem Sturm widersteht. Nous allons utiliser tous les instruments à notre disposition pour que notre économie résiste à cette tempête. This requires coordination between member states, the Commission and the ECB. And I'm comforted that leaders have called for such a coordinated strategy. The Commission will play its full part with no delay. I'm working on the following measures to support member states in their efforts. First of all, we will make sure that state aid can flow to the companies that need it. Second, we will make full use of the flexibility which exists in the Stability and Growth Pact. I will come with concrete ideas before the Eurogroup that is meeting on Monday. On both these fronts, we will clarify the rules for the game for member states very quickly. There will be guidelines by the end of the week. And finally, and third, we will bring forward a Corona Response Investment Fund directed at the healthcare systems, directed at SMEs, and as the labour market, at the labour markets, and other vulnerable parts of our economies. The instrument will be sizable and reach 25 billion euros quickly. To realise this, I will propose to Council and Parliament this week to release 7.5 billion euros of investment liquidity. I will set up a task force to work with the Member States to ensure that the money starts flowing in the coming weeks. Indeed, today marks an important step in a coordinated response that the 27 heads of state and government, the President of the European Council and the Commission have been calling for. Now it's time for action.
Thank you very much. We will distribute the President's conclusions following the press conference, and we'll take a couple of questions. We'll start first with the Financial Times. Yes.
Hi, Mehreen Khan from the Financial Times. A question for the Commission President. So of this 25 billion, which 7.5 billion you want to release immediately, could you tell us where you are finding this money? Is this in the existing EU annual budget? And when we, I guess, have some MFF discussions which are coming on for the later part of this year, will the Corona Fund be a new element in the EU's long-term funding? And just in the next couple of weeks, when will you make a decision, Mr. Michel, on whether or not we're going to have a European Council in a few weeks, which will mean that EU 27 leaders will have to come into Brussels? Or did you find today's teleworking quite an efficient way to keep going as a format for summits in the age of Corona?
The money is within the EU's budget scope. It is connected to structural funds, so we will create these 7.5 billion that will lead further on to 25 billion we can invest then, finally, and spread all over the member states. So in close cooperation with the member states, this will be done. And you had a second part? I forgot.
I confirm that we intend to have this summit in Brussels the 26th and 27th of March.
Next question for Politico.
Thank you. David Hersenhorn with Politico. President, can you tell us if any of the member states announced that they're adopting additional measures, quarantine measures, border control measures like Italy, and also wonder if you're concerned at all by the fact that some Eurosceptics, anti-Europeans, seem to be trying to raise a question of whether the EU has acted with enough solidarity in Italy and elsewhere in these last 24 to 36 hours.
No, we had tonight a very good discussion, and we have together expressed a very strong political message. We have decided to act. We have decided to be fast and to be strong and to work together. And of course, it means that at the national level there is a space for taking responsibilities. But the common goal, the common intention, is to work closely together, and that's why we have taken all these orientations.
Yes, please. Next question.
Thomas Mayer at the Austrian Daily Der Standard. We have seen today very robust measures by the Austrian government. So a shutdown of all universities. They announced they will shut the schools, all major sport events and so on, cultural events too. So my question is, and in Austria we don't have such a high level of infections as we have in Italy. Did you discuss that in your meeting, and did any other head of state, especially in Germany, tell you that they will come to that measures too in the next days or even hours?
Well, first of all, it shows that it is necessary to coordinate on the European level, but I understand very well from our scientists what the reason behind those measures is. The spread of the virus takes place and will take place. The goal is, and the most important part right now is, to slow down the spread, so to prolong the time before infection takes place. With respect to the health sector, because if there are too many infections in too short time, it is a huge strain for the health sector, mainly for the ICUs and for the smaller part of the patients who will need intensive care or respiratory medical support. And therefore, there are different forms of measures that can be taken, but it is supported by the scientific evidence and knowledge that it is a good approach to slow down as much as possible the spread of the virus, and there you have the different measures you were referring to.
Okay.
Anne Gelinek, ZDF Television. Is that okay?
Yes.
A question to the Commission President. You didn't answer David's question about the border controls.
Yeah.
Is that a reasonable, fair measure to eliminate the spread, or is it the beginning of the end of Schengen?
This is a reason why we also decided that the Commission is entrusted to organize on a daily basis conference calls with not only the health ministers but also the ministers of internal affairs, so that we have a very close coordination on how is it done and why is it done, so that the measures are appropriate and timely. And therefore, I think from tomorrow, the next day on, we will have on a daily basis this coordination.
Okay, we'll take one more question. Griselda.
Merci beaucoup. Griselda Pastor de la Radio Española. Sur la pénurie de gel dans les pharmacies pour se laver les mains, la pénurie de masques dans certains endroits, le fait que certains États membres aient interdit l'exportation a donné une image de non-préparation et de non-solidarité. Est-ce que vous avez une réponse ce soir à tout ça?
Il y a une détermination qui a été exprimée à coopérer sur les différents points que j'ai mentionnés. Et le sujet que vous évoquez est un sujet extrêmement sérieux et que nous prenons au sérieux, puisque nous constatons effectivement que pour le personnel médical, pour la capacité à faire reculer la propagation du virus, il est important que l'on puisse veiller à ce que les États membres aient accès au matériel dont ils ont besoin. Et ça suppose effectivement qu'il y ait de la transparence entre les États membres, qu'il y ait le même niveau d'information entre les États membres, et c'est la responsabilité qui a été confiée à la Commission avec les États membres qui vont devoir partager les informations, et avec les secteurs industriels. Il s'agira effectivement de voir où se situent les stocks, où sont les capacités, quels sont les besoins actuels et les besoins que l'on suppose nécessaires dans les prochaines semaines, afin qu'il y ait une gestion dynamique de ce sujet. Et ça vise aussi bien, soyons concrets, ça vise les masques, ça vise le matériel nécessaire sur le plan respiratoire, ça vise aussi les produits qui sont nécessaires pour réaliser les tests, pour produire les traitements qui sont nécessaires. Ça vise l'ensemble des fournitures dont on va avoir de plus en plus besoin dans les semaines qui viennent.
Thank you very much.
Merci
we'll
beaucoup.
Distribute the text and we'll put it online.